Vitamin A, particularly in its plant-based precursor form beta-carotene, has drawn considerable attention for its potential role in cancer prevention. While its more visible benefits, like sharper vision, healthier skin, and stronger immunity, are widely appreciated, its deeper influence lies in protecting the body at a cellular level from the mutations and oxidative damage that can initiate the cancer process. Through its antioxidant capacity, regulatory influence on cell differentiation, and support for immune surveillance, beta-carotene serves as a quiet but powerful line of defense in reducing the long-term risk of several types of cancer. Beta-carotene functions primarily as an antioxidant, neutralizing harmful free radicals that arise during metabolic activity and exposure to environmental stressors like pollution, ultraviolet radiation, and tobacco smoke. These unstable molecules can damage DNA, setting the stage for mutations that, if not repaired, may lead to the development of cancerous cells. By intercepting and disarming these free radicals, beta-carotene helps maintain the genetic integrity of cells and supports the repair processes that preserve healthy function. Diets rich in beta-carotene have been associated with a reduced risk of several forms of cancer, especially those linked to oxidative stress and epithelial tissue, the tissues that line the surfaces and cavities of the body. For example, lung cancer, particularly among non-smokers or light smokers, has shown an inverse relationship with beta-carotene intake from fruits and vegetables. Carotenoids may help counteract the oxidative burden on lung tissue caused by inhaled toxins and chronic inflammation. However, it's important to distinguish between food-based beta-carotene and synthetic supplementation. Studies have found that while a diet high in carotenoid-rich produce is protective, high-dose beta-carotene supplements, especially in smokers, can increase cancer risk. This underscores the importance of context and balance in nutrient intake. In men, beta-carotene may also contribute to prostate cancer prevention. Carotenoids are stored in prostate tissue and may help regulate cell proliferation and apoptosis, the process of programmed cell death that clears away abnormal cells. By encouraging proper cell cycle control, beta-carotene helps maintain the healthy turnover of prostate cells and may reduce the risk of malignancy over time. Several observational studies have found that men with higher levels of dietary carotenoids in their blood tend to have a lower incidence of prostate cancer, particularly when their diet is also rich in other protective nutrients like lycopene, selenium, and vitamin E. Skin cancer, especially non-melanoma types like basal cell carcinoma and squamous cell carcinoma, has also been linked to oxidative damage caused by ultraviolet radiation. Beta-carotene, stored in the skin, provides a measure of photoprotection from within, helping to neutralize free radicals generated by sun exposure. This doesn't replace sunscreen, but adds a layer of systemic support that can make the skin more resilient. Long-term consumption of beta-carotene-rich foods may thus contribute to a reduced risk of sun-induced skin damage and the development of precancerous lesions. Another way beta-carotene supports cancer prevention is by enhancing the immune system's ability to detect and destroy abnormal cells. Vitamin A plays a regulatory role in the function of T cells and natural killer cells, which are part of the body's front line against cancerous transformations. A strong immune surveillance system is essential for identifying rogue cells early and triggering apoptosis before they can multiply and form tumors. This immunological aspect of cancer defense is one of the most promising and synergistic benefits of vitamin A in a balanced diet. Furthermore, beta-carotene helps maintain the health and integrity of mucous membranes, the protective linings of the respiratory, digestive, and urinary tracts. These linings are often the first areas affected by carcinogens and infections that can contribute to cancer development. By promoting strong, resilient epithelial tissues, vitamin A reinforces this physical barrier and limits opportunities for harmful agents to penetrate and initiate cellular damage. What stands out in much of the research is that beta-carotene from whole food sources consistently shows benefits, while isolated high-dose supplementation does not. In fact, large trials like the ATBC, alpha-tocopherol beta-carotene cancer prevention study, and carotene and retinol efficacy trial found that synthetic beta-carotene supplements actually increased lung cancer risk in smokers. These findings serve as a cautionary tale that nutrients don't act in isolation when consumed in their natural context, alongside fiber, phytonutrients, and other antioxidants. They seem to work in harmony with the body's needs. Therefore, the safest and most effective path to reaping the cancer-preventive benefits of beta-carotene is through a diet rich in colorful vegetables and fruits. Carrots, pumpkins, sweet potatoes, spinach, kale, mangoes, and apricots all offer beta-carotene in a bioavailable form, wrapped in a nutritional package that supports overall health. When paired with healthy fats, such as olive oil, nuts, or avocado, absorption of beta-carotene improves, further enhancing its protective effects. In the broader picture, cancer prevention is never about a single nutrient, but about the cumulative effect of a lifestyle rooted in whole foods, movement, sunlight, and rest. Beta-carotene's role in this matrix is significant, especially as a naturally occurring antioxidant that can help maintain cellular harmony over time. It reminds us that food isn't just fuel, it's information and protection for the body at its deepest biological levels. With each serving of vibrant, nutrient-dense food, we aren't just feeding ourselves, we're actively defending against one of the greatest health challenges of our time. Vitamin A, through the subtle but powerful work of beta-carotene, supports that effort every day, making the future a little more resilient, cell by cell.